Great. Welcome, everyone, to our annual ASC check-in on what's going on Capitol Hill and how it affects our ASC members. I'm Mike Picard, the editor-in-chief of the Journal of the American Society of Echocardiography, past president of the ASC, current member of the ASC Advocacy Committee, and I'm a cardiologist at the Massachusetts General Hospital and professor at Harvard University. Today, I'm joined by my co-moderator, Dr. Lisa Rosenbaum, who's a national correspondent for the New England Journal of Medicine. She's also a contributor to the New Yorker magazine, the New York Times, and you may have seen her byline on many other of our news media outlets. She's also a cardiologist in Boston. She's at the Brigham and Women's Hospital, and she's an assistant professor at Harvard Medical School. And our two panelists today are our lobbyists for the ASC from Melman, Castanetti, Rosen, and Thomas, Lauren Aaronson and Dean Rosen. So let me tell you a little bit about both of our panelists. Prior to joining this firm, Lauren served in several senior positions, both in Congress and in the executive branch of government. She was a staff member of the House Ways and Means Committee working on Medicare payment policies. She directed the Office of Legislation at the Centers for Medicare and Medicaid Services. And she was a policy director of the Office of Healthcare Reform in the Obama White House. So she was a key member of the team that developed and enacted the Affordable Care Act. Dean is one of the foremost experts in Washington on healthcare systems. And prior to joining this firm where he's a partner, he's held, again, numerous positions, both in government and also in the private sector. Among those, he was the chief healthcare advisor to former Senate Majority Leader and my friend Bill Frist, who, by the way, is also a cardiac surgeon, if you don't know that. And Dean helped draft and navigate the final passage of Medicare prescription benefits laws when he worked on the Hill. And in the wake of September 11th, he worked on ensuring that healthcare systems had new authorities and adequate resources to respond to future terrorism threats. And I suspect, and maybe if we have time, he'll tell us, I suspect that some of those laws actually may have applied during our recent COVID pandemic and some of the policies that we've had to change for that. And he has another long list of other positions that he's held on Capitol Hill, including he was the majority counsel for the House Ways and Means Committee Health Subcommittee. So with that, rather than having Lauren and Dean give formal presentations, I thought this year we would try to make things a little bit more interactive and maybe be a little bit more off-scripted. So we're gonna, Lisa and I are gonna pose some questions to both of them, and we'll have a little give and take and see how far we get during this relatively short period of time. So before I turn it over to Lisa for the first question, let me actually start by, rather than looking sort of to the future, let's talk quickly about actually what so far this Congress and administration have accomplished in terms of healthcare policy. So I'm not sure who wants to go first, but I'll let the two of you fight that out.
Well, I think since Democrats control both the White House and the Congress, Dean would probably want me to talk about everything they have done. So I'm happy to take the first question. Okay. First of all, thank you, Dr. Picard, and thank you, Dr. Rosenbaum. It is wonderful to be with you all here today. Dean and I thoroughly enjoy working with ASC. It's been a pleasure from our perspective the last couple of years, and we just very much enjoy our relationship, being able to work on behalf of ASC here in Washington and to be able to interact with all of you here today. But to answer your question, Dr. Picard, Congress has obviously been focusing a lot on dealing with the COVID pandemic. So over the last couple of years, we have seen numerous pieces of legislation pass on a bipartisan basis and become law to really try to address the pandemic that we are facing, whether it be issues around global supply chain, global security, coverage issues, new authorities that the government needs. So it really has been a full 100% focus on COVID. In addition to that, there's obviously been a lot of work done as well, generally in the healthcare space, beyond just the pandemic itself. We've seen Congress pass numerous pieces of legislation to deal with issues around affordability. In one of the bills that became law 2 years ago, the Congress provided additional subsidies to make coverage in the Affordable Care Act marketplace much more affordable. Those subsidies actually expire at the end of this year. So one of the things that Congress is debating right now is to extend those subsidy changes because we do know the affordability issues were very critical. And because of those subsidy changes, an additional 1 million people were able to get coverage in the market. So that's one thing that Congress has done and is still going to continue to focus on. Congress has also been spending a lot of time focusing on mental health issues. Just on Saturday, the president signed a bill dealing with gun safety and provided additional funding and new authorization to deal with the mental health crisis that we are facing. There's still a lot of work that needs to be done on both issues, but it is incredibly historic that for the first time in 30 years, we had a bipartisan package to deal with issues around gun safety pass the Congress and become law. So in a world where we have lots of very divisive issues happening, there is still a lot of work that's happening both in Congress and the administration focusing on ways to move the ball forward. In addition, there is a lot of work that's been happening on the future of the pandemic. So Senators Burr and Murray have been spending a lot of time about how do we get to preparing for our next global pandemic. And then there are a lot of bills as well focusing on issues around telehealth, which I know we'll talk about later. But one of the major policies that Congress passed earlier, actually last year, earlier this year, 2022 has been a little bit of a blur. Earlier this year was to provide additional flexibilities for telehealth policy beyond the public health emergency. So as you all know right now, there are a number of telehealth flexibilities in place, which have been absolutely critical to providing care during the pandemic. And I think Congress really recognizes why that a lot of these flexibilities need to continue. So in one of the bills that became law earlier this year, they did provide additional certainty of 151 days, not 149 days, not 152 days, but 151 days beyond the PHE to allow for the additional flexibility and certainty for providers and for patients. Congress is looking at making some of those flexibilities permanent, but we're not quite there yet. But I'm sure Dean has other things he wants to add, so I'll pause there.
Thanks. First of all, let me just add to Lauren's thanks for having us and our genuine enjoyment in working with you all and representing you in Washington. I hope that's not the only thing we agree on, but it may be one of the few things we agree on. No, I'm kidding. I think Lauren did a great job kind of outlining a lot of what's been done and teeing up some of the big issues that I know we'll get into, Dr. Picard and Dr. Rosenbaum, in terms of what could happen going forward. I guess, let me just not go into the details because I think Lauren did a good job covering them, but maybe just add a little bit of a lens on them. I think when President Biden took office, it was clear that his first, second, and third priority was going to be sort of fighting the pandemic and trying to get that under control. If we look back at the midterm election, I think at least my take of it was that he became president in large part because of the referendum on how the Trump administration did or didn't do and the crisis that we were in. So he first came in and passed a large bill, 1.9 trillion rescue plan, trying to deal with the pandemic, and of course kept in place a lot of the authorities that you referenced earlier that we did help put in place post 9/11, but a lot of that was just waiver authority. And as Lauren said, what we've learned, a couple of decades later is that things need to be updated. But that was the focus. Then as we, got into this year, there was the hope that the pandemic might be behind us and the president could turn more at the end of last year, frankly, to more economic support legislation and broader things. That ended up not happening. And what we've seen is, I think, some of the major accomplishments in health and otherwise have in fact been bipartisan, even though you call the gun agreement relatively incremental, but it was a big breakthrough, as Lauren said. There was also a bipartisan infrastructure bill. But while there's a lot to do, and I know we'll talk about it, I think the frame of the country, and therefore I think the frame in Washington, has shifted a lot. And even though we've got probably a higher daily incidence of COVID today than we did last year in June and July, the country seems to have kind of moved on from mask mandates, as you know, from vaccine requirements, vaccine passports, even in the more liberal parts of the country. And so the focus now is really on a very different set of issues, including this soaring inflation. And in fact, as we'll talk about, not only the areas of agreement, but just to set up some of the areas of disagreement. Ironically, the first bill, this rescue plan that Lauren talked about, that included enhanced ACA subsidies, that included support for vaccines and other things, just to sort of talk about how things have shifted in maybe 2 data points. Number one, when it came time a couple of months ago for some of those funds to be replenished, the administration proposed about 30 billion in spending. There was a bipartisan agreement for only about 10 billion in spending, and that couldn't get done for various reasons. So in part, it shows the magnitude of 1.9 trillion a couple of years ago to not even 10 billion this year. The other thing is that bill, the 1.9 trillion, is one of the things that Republicans will campaign on in this election, because of the view that spending that amount of money sort of put fuel on the flames of what was already kind of an inflationary economy. So in part, we're seeing, as we often do, a little bit of schizophrenia here on healthcare policy, with a lot of things that there's an interest in, a lot of things that have in fact been done, and including some things that have been done in a bipartisan way, and also healthcare, as we'll talk about, being sort of a flashpoint for these broader issues. So just a little bit of an additional lens that I think will set up further some of our discussion.
Great. Lisa, let me turn it over to you.
So first, it's just really nice to meet you both and hear your perspectives. So now that we've talked about what's been happening in the past year, I want to switch gears and talk a little bit about what you think will be the focus of health policy in the coming year. And also if you can touch on issues that you think will be most relevant to our ASE members.
Sure, I'm happy to start. So we are definitely in a busy season right now in Congress. And so a lot of focus right now on a couple of key health policy items. As I noted, there's still a lot of work happening on areas around mental health. So that package should become law on Saturday, but there's still other work that's happening in the mental health space. There's also a lot of work happening on pandemics, which we talked about a few minutes ago. Expect that a large package relative to new authorizations and flexibilities to prepare for the next pandemic could become law later this year. And most of it will be right now, Democrats have been talking a lot and moving forward on a reconciliation package. It had been previously known as the Build Back Better plan. And reconciliation basically means that it is a privileged motion. So generally in the Senate, you need 60 votes to move forward on a bill. But if you use the budget reconciliation process, you can move legislation with just 50 votes. And so it is, that means though that any policy that's included in that bill has to have a direct impact on the federal budget. So Democrats in Congress, sorry, go ahead, Dr. Picard.
So I don't want to interrupt your train of thought, but is 50 votes even realistic in this?
That's a great question. It is. And the key, there are many key senators who are involved in this, most notably Senator Manchin and Senator Sinema. So that has been a big issue of conversation among Democrats over the last few years. There originally was a thought that this bill would be enormous. And I think Dean noted on this earlier. The original bill that passed the House was almost $2 trillion and included a variety of policies. It was supposed to be sort of the next New Deal. But Senator Manchin and Senator Sinema as well had raised various concerns, not only with the size and the scope of the package, but also just with some of the substantive issues. So Senator Manchin, has some concerns with the child care tax credit and paid family leave, whereas those are high priorities for Senator Sinema. Senator Manchin feels strongly about doing really aggressive reform on the issue of prescription drug pricing. Senator Sinema has concerns with that. So we are a little bit like herding cats, and this process has been going on for well over a year. But it is notable that actually even last night, the Senate Democrats did announce that they are moving forward on the process. Hopefully the bill will pass the Senate before the August recess. And they are very much looking at a slimmed down version. So expect there potentially to be a bill that becomes law that would, one, largely deal with some of the inflationary issues that Dean noted. Senator Manchin feels strongly they focus on deficit reduction as well. But the key pillars at this point will be issues around prescription drug pricing, potentially extending those ACA subsidies that I mentioned earlier, some tax reform, and some issues around climate. So this is going to be a much smaller package than Democrats had originally envisioned getting done about a year ago. But I'm still pretty optimistic that there'll be something that becomes law later this summer on that issue. In addition, there are some other bills that need to get dealt with. One is the user fee package. So a lot of the staff at the FDA are paid for by actually user fees that the industry pays to the government to pay for their salaries. And that has to be reauthorized every 5 years. And they are the best acronyms in Washington, known as PDUFA, MADUFA, BASUFA, GADUFA. It is, as we in healthcare, as you all know, acronyms are wonderful, but those are some of my favorites. And so both the House already passed their bill on a bipartisan basis. The Senate passed their bill out of committee, but not full Senate yet, but they are pre-negotiating, and the hope is that will get done soon, because if they don't do it, then FDA will hand out pink slips to lots of staff, and no one wants to see that happen.
So just to clarify, that is when a device manufacturer brings a new product for approval, they pay fees to
Yes.
the government?
Yes.
Yeah,
So
it's
as long
both
as-
drug, it's both
And
drug
it's
and
drugs
device.
and devices.
Okay.
Drugs,
So-
devices, generics, and basically they're charged on a basis that gets negotiated between industry and the FDA, and then Congress passes it, and basically those enhanced fees outside of taxpayer dollars help to fund more personnel, and theoretically those personnel, review things more quickly, et cetera.
Okay, great.
And then to the second part of your question, Dr. Rosenbaum, from an ASC specific perspective, obviously the telehealth issues are something that Congress is continuing to focus on. There have been a lot of conversations about the sequester reductions that take effect, which obviously is a big issue for a lot of providers. Unfortunately, Congress is not right now really looking at sequester, and the pending cuts are going to take effect on July 1st. I don't think that
This is, by the way, this is a couple of years ago when there was an effort at deficit reduction and the two parties couldn't agree, and then President Obama, they basically, among other things, sort of put in place these automatic across the board cuts for Medicare and other programs. And during the pandemic, Congress basically suspended those and then sort of phased them back in. And so they'll be fully phased in at a 4% cut, Lauren, starting here in July. Or is it 2% cut? So they'll be fully phased in, and there was a lot of interest in health plans, hospitals, physicians, almost every healthcare stakeholder in saying, wait, we're still having a lot of supply chain, a lot of cost issues. Let's further delay that. But as Lauren said, that looks unlikely to happen. But there's a few other provider payment issues that you'll probably touch on that I think are of interest here to ASE as well.
Yeah, and I think on that last point, Congress, I think, certainly recognize that providers on the front lines and that things are not are very challenging in a lot of institutions across the country. So I think it's possible we could see some relief later in the year to provide additional dollars to providers, given just the overarching challenges we've seen over the last few years. So lots still to happen, even though it is a very divisive time here in Washington.
And I just add, Dr. Rosenbaum, that I think the other thing that I think will be of interest to ASE and indeed, all physicians is that kind of as we come to the end of the year, the Medicare issues are sort of looming. And I think what the physician community sort of figured out is that because we're really the only sector that is subject to, what we call kind of budget neutrality, which is if a specialist gets a little bit of an increase, another specialty might be cut to offset that, and as you know, and the same with primary care. So the result of that is that in real terms, as the physician community and the AMA and other lobbies here and ASE have projected it out, what it means is that the reality is, looking out into the future, physicians are going to face continued cuts in effect in the Medicare reimbursement area. And there's a lot of interest in trying to figure out ways to reverse that, particularly given the challenges that that everyone in the healthcare sector has faced over the last few years in terms of COVID and some of the resulting issues in terms of labor costs, supply chain, and other things that are putting a lot of pressure on. So I am not, I'm with Lauren. I'm not confident that we're going to get sequester Medicare relief. I'm not confident we're going to get a huge big fix to Medicare physician payment. But even at the end of last year, Congress did have a little bit of a package to help prevent some cuts from happening. And I could see some of that happening, not in a long-term basis, but maybe an incremental 1 year at a time basis. So in some ways, we're kind of back to this debate we used to have around the sustainable growth rate of the SGR, where Congress would fix it every year. We may be in a position where, almost every year Congress is going to be faced with these issues of how do we deal with physician payments, at least that look like in real terms they will probably continue to decline unless more is done.
And with inflation, that decline is even going to have more of an impact, I suspect, on practices. Let me just follow this up, since you talked about some of the issues that may impact our members. And I know both of you have access to lots of deal makers on the Hill, but I know that our congressmen and senators like to hear from their constituents. And so what can our members actually do, or what are some of the things that they should be writing or calling their Congress members about? Are there specific phrases they can use, or topics that they should comment to their legislators about, particularly in the summer when some of them are coming back to their territories, their districts to meet their members?
Yeah, absolutely. I think members of Congress always love hearing directly from providers and constituents back home. And I think given your direct experience on the front lines of the pandemic, I think it's critically important. They understand the elements at a high level about the policy, but it's really critical they hear directly about what's actually happening on the ground. And generally they want to understand what's happening. And so I think just engaging and saying some of the challenges you're facing, what has worked, what hasn't, has telehealth flexibility that Congress enacted been helpful? What more can Congress do? I think that information is critically important. I think the other key thing is, though, when we're talking with members of Congress, it's important to say not only here are the challenges we're facing, but here are some of the solutions that we believe Congress should focus on. They really like actionable items. So I think that's another key thing I would note.
And I would just say, I think in addition to that, and I know the ASC has done a good job in developing our policy priorities, and so we can probably point people to the websites or to Irene Butler and all others to amplify our policy priorities. And Lauren makes a good point. But I think that maybe just going back to a remark I made earlier, I think a lot of policymakers, like a lot of the American public, are sort of ready to be, kind of over COVID at this point. There's a lot of pandemic fatigue. But the reality is, I think the pandemic has had a couple of lingering effects, some good and some bad. On the good side, because of some of the waivers and flexibilities, we got more robust telehealth coverage, for example. And I think that's helped cardiology practices. It's helped physicians across the board to reach patients. I think we've all learned that, we can do things like this, Zoom dialogue as opposed to being in person. And so I think it's important to, point out to policymakers to be, even more concrete, some of the good that has come out of it that we want to preserve and build on. I think it's also important to point out some of the challenges, as Lauren said, and we've kind of referenced to earlier, which is, we've got inflation that we're dealing with. We've got continued labor challenges in almost every practice across the country. We've got workforce issues. We've got continuing supply issues. We've learned how fragile our supply chains are. And those, unless things are addressed, are going to have an impact. So I think reminding people and sharing personal experiences, maybe even more importantly than just phrases, is really important.
And I guess to follow that up, in terms of telehealth, it's really important for our legislators and actually people on Medicare to understand that some of our elderly patients aren't very facile with computers. And so they're still relying on phones. And so this distinction between payments for video visits versus just audio visits is important for some of our members who are in practice. And I know that's come up a few times. And the other issue is sort of state lines and medical licenses. So if I'm in Massachusetts, but my patient lives in Connecticut, and when they come to the office, it's not an issue. But if I'm doing it remotely, there are some legal issues about, if I don't have a license in California and reciprocity. Obviously, a lot of us up in the Northeast have our patients go down to Florida in the winter time, and so I'm sure that this issue of telehealth and where your license is and states' rights versus more national things will hopefully come up and get resolved over time.
Yeah,
and I think,
which is on that point. So I think on the scope of practice issues, Congress is generally hesitant to really get involved and want to defer to the states. But given, obviously, I think the telehealth work that has happened, the global pandemic, I think there's definitely an openness to thinking about what can Congress and the administration do that is more sort of interstate compacts that are voluntary. And so I think that's also particularly playing out in the mental health space as well. So I know that doesn't quite get to the world that we're in from an ASC perspective, but I think that if they're talking about voluntary interstate compacts, which do exist already now, and how do you continue to incentivize them? I think if we're starting with mental health, we can certainly see that continue potentially to other areas as well, because I definitely think that Congress and the administration recognize why this is necessary, particularly with the shortage of providers. And then on your point about audio only, it's an excellent one and something that Congress has been focusing on and the administration. I think there's definitely openness to continue reimbursing for it. The only hesitancy I think that the administration has is allowing it on the Medicare Advantage side for risk adjustment purposes. I think there's some concern there for potential upcoding, but as it relates to just the provider relationship, I think that they fully recognize that, you know, you both have a senior and, you know, elderly community that may not have access or understand how to use Zoom or FaceTime or any of those interfaces. But then too, depending on where you are, if you're in a rural part of the country, you may not have great broadband. And so, you know, the telehealth issues and allowing audio only to count is really critical for those areas of the country where there's just that really those deserts of broadband.
Can I ask a follow-up question? If I were to write a letter, I would want to understand, you know, what hurdles I was trying to overcome in terms of either like reticence to pay for telehealth visits or the friction between the two parties. So maybe one of you could speak a little bit when we talk about issues around telehealth. Is there friction between the Democrats and Republicans in terms? No. So
there isn't actually. It's one of the few. I mean, there's several areas now, but this is one area that has been bipartisan for a very, very long time.
I think it's less ideological issues, as Lauren said. I think the barriers for policymakers and you know, you might have some differences in parties, but I think the barriers are we've had these pretty broad waivers where there's been, you know, some flexibility on licensure, although a lot of that's happened at the state level. You've had, you know, some parity on reimbursement, as Dr. Picard referenced, and now I think we're at a time where to go forward and make some of this policy permanent, it's going to cost money. And that's where often the rubber hits the road. And so the question is for policymakers of both parties, to Lauren's point, Dr. Rosenbaum, is, you know, what's appropriate increased utilization and what may be, you know, just duplicative or not appropriate, you know, utilization. Do we really need to pay exactly the same for bricks and mortar visits as telehealth visits, because obviously, you know, facility costs are not, you know, you may need less labor to deal with it, but clearly for physician time, the time's the same. So I think it's those kinds of detailed issues that, you know, people have kind of said, well, you know, we got this waiver in place, we don't have to delve into the details. I think now they're starting to delve into the details, and I think it's less of a partisan interest and more of a kind of a budgetary question and appropriateness question. So
two things. Lauren mentioned upcoding, and I just, for the record, want to state that our ASC members never practice upcoding. I want to get that off the table.
And then, I think the concern is more from the plan perspective, not the provider perspective.
Okay. And then from a logistical standpoint or practical standpoint, if I did want to contact my senator or my congressperson, who do I speak to when I call or when I write? I mean, should I be asking to speak to the healthcare expert there, or should I ask to speak to the congressperson, or you know, what's the best way to actually get my message across?
I think it's great to start with the healthcare advisor to the member. That's always a good place to start. But I think depending on how the conversation goes, I mean, certainly requesting a meeting with a member of Congress is something you should do. But we always find that staff want to have a conversation first before the member does.
And does
to make sure that the member is fully briefed and can have an informed conversation with you.
And does everyone have a specific healthcare advisor, or is there another term that we need to use? Okay.
No, they do, but they may, depending on the office, they may have a policy person who works on healthcare and several other issues. But yes, they will have someone who works on healthcare policy.
Great. This is great.
Yeah, I think the other thing, Dr. Picard, is two things. One is a lot of times the policy people, be they healthcare or environment or tax or whatever, are in Washington. But a member of Congress that, in your hometown often has like a staff person who's a district director or state director. And those are sometimes really good people. They don't have to be experts, but they're really attuned to local constituencies. And so those are good folks too, if you just, know someone local. The second thing I'd say is that, one of the benefits I think of what the ASE does is, to try to, it's been hard the last couple of years of the pandemic, but to try to have regular opportunities with fly-ins and meetings and things to kind of walk the Hill and meet legislators and share our priorities. And in addition to just the relationships that Lauren and I have and sort of use on your behalf, those are really good opportunities to just develop it and sort of say, oh, now I'm meeting face to face or via Zoom or phone call with the healthcare advisor to Senator Schumer or to, Senator McConnell or whatever it might be. And then, and then a follow-up on a particular issue becomes a little bit easier because you've got a portal that's been established. So I just wanted to also put in a plug for what the association does in terms of trying to help connect its membership directly with policymakers, because I think you've obviously been very involved, Dr. Picard, but I think it's hugely valuable to trying to establish those relationships early and often.
Yeah, that's a great point. So for those who are listening in, if you do plan or are interested in meeting with someone, if you contact Irene Butler at the ASC office, she can certainly help you with talking points. We have a lot of handouts. And certainly if you have a specific issue you want to speak to someone about, she can help you craft that message, and even get Lauren or Dean's thoughts on some of these things. So I'd encourage our members to check in with our advocacy office. So this is great so far. I'm really enjoying this. Lisa, do you want to throw out another topic or question?
Sure. What are the administration's goals, do you think?
Happy to take that one.
That's for you, Lauren.
I'm happy to. So in addition to obviously dealing with the pandemic itself, we've seen a really incredible interest in focusing on issues around health equity. We're seeing that play out in almost every major rule and regulation that the administration is moving forward on. They feel really strongly personally about this, both from the president's perspective, the vice president's, Secretary Becerra, the CMS administrator, Chiquita Brooks-LaSure. So issues around health equity, I would say, are really critical thematically throughout the administration and everything that they are doing. And that's also a bipartisan issue. I think there's a lot that Congress wants to focus on here as well. There are a variety of ways, of course, on how to address this, because it's obviously there's no one way you can solve health equity issues, but they are very much focusing on, and I think doing everything they can within their levers to try to move the ball forward on that issue.
Can you
sorry, go ahead.
No, I mean, I think it's something obviously that we're talking a ton about in medical circles too. And I guess I'm curious substantively, like what are they doing?
Well, no, it's a great question. I think for the first year or so of the administration, we saw a lot of questions being asked to providers and stakeholders with virtually every major rule that came out, whether it be, the inpatient rule, the outpatient rule, the physician fee schedule rule, were requests for information and really just trying to take in thoughts from experts about how to address this issue. So I appreciate the way they went about it. And really trying to engage, providers in the front lines and consumers on this issue. So they've gone through that for quite some time. They've done a number of stakeholder roundtables, but I think it's obviously a struggle. I think we've seen some areas around focusing on maternal mortality and areas, how do you deal with that, particularly in the African American and Hispanic community. We've issues around language barriers, issues around social determinants of health. And so where you have food deserts, how does that then impact access to care and people then, having, later developing to diabetes if you're not having the right diet. So there are obviously a lot of levers here that are much broader than just the ins and outs of a policy piece, but how do you look at the patient from a more global perspective?
I'm a supporter of the administration, but I do have to say, I think they need a better PR agent. I don't think they've been able to.
Oh, there's no question, Dr. Picard. You're absolutely right.
They haven't been telling the public that they've been doing anything.
Yeah.
And so I don't know that we see a lot of these things that you're talking about.
Mm-hmm. No, I would, I'm a big supporter of the administration too. I fully agree. That has been a challenge.
I won't I won't pile on because no administration is perfect. But I think one thing that I would say is I think that they've been, as I said before, so focused on the pandemic. You've got a lot of new folks, even though a lot of them, like Lauren, had served in the Obama administration, knew their way around CMS and HHS, but it was still a new dynamic, kind of getting used to one another. And I think that that they, in some ways, my sense is early on, they really haven't remade the world in terms of putting their stamp on, how they wanted to see the future of Medicare. You look at some of the rules, the payment rules this year, you can almost categorize a lot of the proposed rules and final rules, Medicare Advantage and other things, as kind of status quo. A lot of what they did, I think, was seek information in the form of RFIs, requests for information, clearly around things like equity. They've kind of revisited some of the demonstrations with Liz Fowler at the Centers for Medicare and Medicaid Innovation. But I think it's been a couple of years, frankly, of really getting their sea legs a little bit. And I think, frankly, both from a public relations standpoint and from a substantive standpoint, being overshadowed by just trying to deal with the ongoing impacts of COVID, and in their defense, not trying to upset the apple cart too much in terms of radical proposals. But I also think that look, healthcare is not a huge priority, has not been a huge priority throughout the president's career. I think there's a lot of mixed reviews of Secretary Becerra's tenure and how aggressive he has been, or how much of a figure he has been. And I think it'll be remain to see in the next 2 years of the administration whether they try to move more aggressively in some of the areas now that, particularly, like, just take equity, they've got more information and they could move more aggressively in terms of measurement. And Lauren may find that critique unfair, but I'm trying to be even-handed in sort of defending them on the one hand, but also the reality of, I found them to be a relatively status quo team so far, but that may not have been a terrible thing given the rocky period that we're in.
So what you're saying is it's spending a lot of time putting fingers in the holes that are coming through the dike. It's hard to.
Yeah,
to
I
do
wouldn't.
new
I obviously take a different perspective than Dean on the administration here, but I agree with the last point that I think that they, particularly within CMS as well, they lost a lot of career staff who have known these issues and worked on them for decades. And, having worked at CMS, I have nothing but the utmost of respect for the career staff there. They are the hardest working people I have ever known, outside of Dean, of course. Although I joke, they're just incredible. And, the last 4 years in the previous administration were really, really tough. And they lost a lot of people. So you can't underscore enough how they have to get just the department itself back in place in a way that can truly help serve the beneficiaries they're serving, whether it be on Medicare or Medicaid. And I think particularly there's just a different approach here. I'd say this administration is much more focused on actually providing coverage and providing care. And I don't think the previous administration was focused on that. So I think it's just a little bit of a reorientation as well, as it is, I think the way you phrased it, Dr. Picard, is right on. It's kind of like sticking your fingers in the holes and just trying to rebuild. And then beyond that, I do think some of the criticism of Secretary Becerra is a tad unfair. I've known him personally for 20 plus years. I think when you're coming in that role in the middle of a global pandemic, you're never being set up for success. And obviously a lot of the pandemic response was being driven by the White House. And so I think that sometimes when you have a lot of cooks in the kitchen, that is sometimes challenging. I will say, I think they are getting to a good groove now. And I think, the early part of any administration is challenging to deal with. But I'd say in particular for my friends at CMS, they have as I mentioned earlier, immense amount of incredible career staff, but two, the political officials who have gone in, whether it be the administrator, Chiquita Brooks O'Shore, the deputy administrator, John Blum, Liz Fowler, these are all people who have been in government before. And so they truly know how to fix the ship, right the ship, and then keep the ball moving forward. But I agree with you, Dr. Picard, they haven't done a great job of kind of talking about those successes.
So I think we're going to have time for two questions. I'm going to pose one, and then Lisa's got a great one, I think. And these will take a little bit of time. But before we do that, I want to mention to our audience, we're actually taping this on June 30th. We didn't tape this during the ASC meeting because we wanted to wait as late as possible because so much has happened. And in fact, just in this last week, just actually with the hearings with Cassidy Hutchinson this week, and with all the things the Supreme Court's been doing, I think I'm glad that we postponed this as long as we could, so that we really are providing up-to-date information. So, so Dean, I want to throw this to you. Unless people's opinions change after the hearings this week, I suspect there's a high probability that the makeup of Congress will change in terms of our Republican-Democrat ratios. And if the Republicans take back the House in this midterm election, what do you see as their healthcare agenda? And again, how do you see things that will impact our ASE members, either good or bad?
Yeah, it's a great question. And I mean, I think, obviously you have the elections, not just the polls, so you never know, but it does look pretty clear that the House is going to change hands, even with the Dobbs decision. And as you said, with the January 6th hearings, the kind of the election die seems to be a little bit cast around inflation and the economy, even though clearly some of the events of even the last couple of weeks, as you referenced, will drive Democratic turnout. I think the Senate may or may not flip, could go either way, but I think the House dynamics are hard for the Democrats. If the Republicans take over, they've already started to lay out some of their agenda. It's been at a high level, but they've set up a series of task forces. And if anyone who's listening to this recording is interested, you could go to Kevin McCarthy's website, Leader McCarthy's website, and there's a number of different task forces on climate, on China, on trade, on energy, and on healthcare. There's something called the Healthy Futures Task Force, and there's various subcommittees, including one on provider-patient relationships. And there they've started to outline some of their views. Now, the caveat is they're like 1 or 2 pages as opposed to detailed legislation. Some of it is really more criticism of the Democrats' approach than outlining what their own approach is. But some of it's very consistent with what we've talked about today. I would say less focus on coverage and spending money, more focus on efficiency, less focus on sort of, ratcheting down on payments or drug cost controls, more on innovation. So in some ways, I think what I've seen from the early pieces of it is sort of defining themselves as where they might have differences with Democrats on those issues. But as Lauren noted, on maternal and child health, on some of the issues around health equity, although I think they would define it more broadly to include not just racial and ethnic, but also economic and geographic disparities. There's common interest. I think there probably is going to be a greater focus on deficit reduction generally by the Republicans. But I think, it will not be an aggressive pro-expansion of government, pro-coverage. So things like coverage gap, which is trying to provide some subsidies for the 12 states that haven't expanded Medicaid, or extending the ACA subsidies. If those things don't get done this year, they're probably not going to get done, at least in the next 2 years. And the last point I'd make, because you asked Dr. Picard about opportunities for us, there's about almost 30 members of the House of Representatives Republicans that are physicians, nurses, or been involved in healthcare as pharmacists who are part of a doctor's caucus. And they, back maybe even a decade ago, a lot of the physicians in the House and the Senate were not always on the key committees. They were sort of, off on the side. But now when you look at some of the members of the House Energy and Commerce, Ways and Means Committee, which are 2 of the key committees with jurisdiction over issues we really care about, a lot of them are physicians. And I think they're going to look at policy issues from a provider and a physician perspective. That may not always align with our priorities, but at least, there's an opportunity, I think, to kind of talk colleague to colleague with a lot of them, which I think will be a helpful thing.
Lauren, do you want to respond at all to any of this in terms of?
She really wants to respond, but she's trying to hold her tongue.
I mean, do the Democrats have a response to? I mean, they've obviously, I'm sure, been to McCarthy's website and seen those agendas. I mean, do they have a response to some of those things?
The Democrats really aren't taking the Republican agenda seriously at this point. I think they're really just focusing on trying to maintain the majority, which I apologize, there's a fire truck outside our office today. I think I'm more bullish that the Democrats will retain control of the Senate, I think probably than Dean is. I'm not willing to fully give up on the House, but I agree that it's not looking great for Democrats to maintain control of the House. But I'd say in terms of your specific question, Dr. Picard, the Democrats are not really paying much attention right now to what the Republicans are putting out.
So
I'd say one other thing, Dr. Picard, if I could, just in terms of what I'd expect, which is in some ways not so much a Republican issue as otherwise, but my own take, and this will bear out if you're kind enough to have us back next year at this time, is that I think that for Republicans, healthcare is almost never a top issue. And if you look at the polls in this election, it's the first time in all the time that I've been doing this that healthcare is not a top 3 or 4 or 5 issue. The issues that are animating this election, be they the economy or abortion or other things, are not really about some of the core healthcare coverage and other issues. I think that next year with divided government, what you're not going to see is, I don't think you're going to see the Republicans, frankly, have a really radical or even aggressive agenda on healthcare. I don't think you're going to get back into repeal and replace. It's not going to happen anyway. The president's going to be a Democrat. As Lauren notes, if the Democrats hold the Senate, even if Republicans take control of the Senate, it won't be by very much. So I think there actually will do a number of bipartisan things next year and put some points on the board that are maybe more singles and doubles. I know I'm mixing metaphors in terms of sports, than trying to swing at things. But I do think that the Dobbs decision, in terms of health and health related issues, we could see a lot of focus on choice and life and abortion issues, both at the state and the federal level, that impact telehealth, that impact FDA, that could dominate a lot of the next Congress in terms of a healthcare agenda, at least as I see it from today.
So to summarize, I think fee-for-service is still going to be intact. We're not going to see a lot of reform in terms of payment reform, practice reform, it sounds like, regardless of what happens. So I think that Dean's last points are a great segue, Lisa, to your next question. Do you want to throw out another question? You're on mute. You're still on mute. There you go.
That has to happen once during every Zoom conversation, or it's not actually a Zoom conversation. Somebody has to stay on mute. It was bound to be one of us.
I know, it's like my favorite line. You're on mute. It always happens. So I want to talk about abortion. You did offer me the perfect segue. So obviously a lot of us in the healthcare community and across the country are reeling from the repeal of Roe v. Wade this last week. So I want to hear a little bit from both of you about what recourse we have legislatively or in the states in terms of providing access to abortion for people in this country. And I think I'm also interested not just in technically what's possible in terms of passing legislation or leaving it to the states, but also what you think is the most pragmatic approach, given how polarized we are as a society, and certainly are around this issue.
So Dan and I obviously have very different views of the issue itself. So it's been a little bit challenging, as much as we are like siblings, for us to talk about this.
And I'm sure our members also have.
Totally, absolutely. I'm sure. I think to answer your question, to be honest, I'm not sure there's a ton that the Congress can do at this point. I will say that the president actually, while we were taping this, did suggest that there be a carve out from the filibuster rules to deal with this. And so I think that is something, that Democrats have been talking about. I'm not sure I see actually legislation happening at the federal level at this point. I mean, the House did pass legislation prior even to the formal ruling to try to protect a woman's rights to choose. But obviously the Senate dynamics are much different on this. I can't speak for Senator Collins and how she has publicly said herself she feels like she was lied to by Brett Kavanaugh and Gorsuch. But I think obviously it's going to have significant reverberations. I think when the House and Senate come back from July recess, I think we'll definitely see some additional votes, both in the House and Senate, but I don't expect anything legislatively to become law. I think more of the issue in terms of federal action will be from the administration's perspective, and what can they do to continue to provide access through whether it be Plan B or other elements that don't necessarily need to be done through the legislative process. So I think we'll see much more of a focus on the administration exercising their flexibilities. And then in terms of the state, we've already seen lots of states act, both in terms of protecting women's rights, but then also in and from the different perspective. And so I think that is going to be a real challenge, and we're going to see it play at the state level. I thought it was notable that in Louisiana, the bill that become law in Louisiana also penalized providers and had providers doing jail time and then also paying significant fines, and that was struck down. So I think it's a little bit at the state level going to be what is the implications for the women, but also what's the implication for the provider. And I think that's just really going to vary state by state.
Yeah, let me just add, I maybe kind of break my comments into the immediate at the federal level, and then the kind of the broader issues. And again, I know this is a deeply held view where almost where people are really on one side or another. So it's even difficult for us to make comments. And as Lauren noted, even though we talk about everything all the time, this is one thing we don't talk very much about because of our differing views. But in the near term, I think that there's not a lot that Congress can do or will do. There's not even 50 votes in the Senate, even if you were to get rid of the filibuster for some of the legislation, that might pass. Senator Manchin and others who we referenced earlier are not for it. So I think the stuff that gets voted on, and I think the House will pass some things, are largely going to be sort of symbolic, or they're going to be kind of ginning up an electorate on one side or the other. You're going to see Republicans, by the way, propose bills too that will gin up their electorate. So there are two sides to this coin. I think the real action will be at the administration level, at the federal level, to do anything. They've talked about protecting access to telehealth. There was an announcement just yesterday. Another good reason, Dr. Picard, in your wisdom, to wait. We've now got more clarity on some of these things. They've talked about protecting access, as Lauren pointed out, to some of the medications. So I think you will see some administrative action to try to protect and preserve that. Over the longer term, this is going to be a tough issue that I think is going to be with us for a number of years, and that we're going to see play out in some ways. We would have been having this debate, this discussion, this legislating for the last 50 years if we hadn't had Roe in place, and now it's going to play out, but of course in a much more complex society than we had back in the 1970s, with medications that are available, with telehealth that's available, and those things are going to make it really fraught. So you'll see states not only pass their trigger laws and other things on one side, you'll see blue states who will want to be havens and opportunities for women to get abortion services and access those healthcare services, and that will play out. You'll see conservative states, and legislators are talking about this, trying to test the limits of, can they restrict travel, or can they provide a private right of action for citizens to sue based on the Texas law if somebody not only gets services in their states, but aids or abets somebody to get services in another state. So you will see both sides of this coin. And I guess I would just say that I'm not sure that we're ever going to settle this great debate in the country, but it's now going to be part of our messy democracy, as opposed to, at least for the near term, part of the court. And I think that will play out. And the last thing I think is that I guess, as a bit of an institutionalist, I would just say that there is two sides of this coin, and there's also, I guess, a risk or an opportunity, depending on your perspective, that Democrats could gain a couple of seats, or maybe they hold the House and they do get rid of the filibuster and protect abortion rights. It's also possible that Republicans win the House, win the Senate, and win the presidency, and decide that they're going to outlaw abortion rights in 2 or 3 years, and that is always a risk too. So this is a really I think uncertain time, a really fraught time, and I think we're going to see this debate play out both at the national and the local and the state level for a long time to come.
Great. So I think we've come just about to the end of the hour. I think we've got another 5 minutes or so. And I wanted to give everyone here on the panel a chance to provide some comments and concluding comments. So maybe I'll start with you, Lisa. Having heard this, you're new to this session that Dean Lauren and I have been doing now, I think 5 or 6 years. Any takeaways that you've got? I know I'm putting you on the spot, but we'll go Lisa, then Lauren, and then Dean.
Yes, I think, well, I have so many thoughts in my head. I guess it's refreshing to be part of something where we can sort of talk openly, even though not everybody has the same opinion. So I really value that as sort of something that we need more of in our society. I think that in this moment, the issues around abortion feel like overwhelming, and it's hard for me to think past those right now. And I think that the telehealth discussion is interesting insofar as there's bipartisan consensus and perhaps more than anything, a disconnect between those making policies and those on the ground, which certainly is an issue that affects a lot of healthcare policy. So I think that was illuminating for me to hear about. So thank you for that.
Great. Lauren.
Sorry, still muted. Well, I appreciate that. And between, issues around the Dobbs ruling, issues around guns, Cassidy Hutchinson's testimony, and obviously everything else we're facing in the last 2.5 years, it's been a very challenging dynamic. But I agree that it's great to be able to have this conversation. We absolutely love and adore working with ASC and everything. I appreciate everything that you all are doing on the front lines to keep us all healthy and safe. And we just look forward to continuing our relationship and advocating on your behalf in Washington and doing everything we can to make sure ASC's voice is heard.
Well, thanks. Well, I'm really glad that Dr. Rosenbaum and Lauren went first. They got the tough assignment, but I think what I would say, maybe sort of starting with ASC and our issues, and then sort of bridging is, I think that it's really important to remember that even though we're at a time of a lot of significant disruption in our political and policy environment, that the issues that we're advocating for are not really partisan. I think one of the reasons that you continue to tolerate me and sometimes Lauren is that we need to talk to both sides. We need both sides to get things done, not only in a close Congress like the one we have now, but that's been kind of true almost of all time. Even if you got something done with one party, that's not as durable as when it's embraced by both. And our issues are not partisan. Both parties want to preserve access to quality care. I think both parties want to make sure that physicians are appropriately reimbursed. I think they want to make sure that there's that emerging technologies used appropriately. Those are all really important issues for us, and those things are not going to change as a result of the January 6th hearings or the Dobbs decision last week. So I think that's important to remember. I think it's also important, not only is it kind of fun for Lauren and I to talk about these broader issues, but I think it's also important for ASC members and for all of us to understand the context that we're having this dialogue with folks in, which is in the 30 years, and Lauren will say I'm just old, but in the 30 years that I've been doing this, I mean, this is the most divisive time that we've lived through. I mean, we have emerging from a global pandemic, and we almost had an overthrow of, or the first time in my life that I can remember, a non-peaceful transfer of power at the national level. And you've got a very divided country, not just because of the politics in Washington, but across, I think, in our neighborhoods and communities, we feel that. I think there are less than 30 truly competitive seats in the House of Representatives right now out of 435, where it's even possible for someone in the other party to win because of the fact that we're kind of dividing ourselves into red and blue counties, and even the social media that we look at. It was I think the iPhone's birthday the other day, and it reminded me that my kids have grown up in an era where this is how they communicate, and this is where they get their news, and the algorithms reinforce the stuff that they like to read. So it's a complex, a divisive time. The economics and the social issues feel really torn and raw, but I think it's really important for us to recognize that while that's happening, you know, we have to keep marching forward on our priorities. We have to figure out a way to communicate our messaging, Dr. Picard, as you referenced earlier, to people who are decision makers on both sides. And we have to recognize that there's going to be more change than ever too. I mean, this will probably be the 11th election in the last 13 where we've seen a change in control in Congress or the presidency. And so we're not talking to the same people now that we were who passed the Affordable Care Act. It is totally different. And we're not going to be talking to the same people now who will be there in 5 years. So we've got to maintain those relationships. We've got to maintain our credibility. And I think, you know, the AAC does a tremendous job of that against a very, very difficult backdrop.
Great. And I'll end with a few comments. So I know our members struggle with workforce issues. We're having a hard time sort of training and maintaining sonographers in many of our practices for a variety of reasons. Affordability, as we talked about earlier, is an issue. So I want to encourage everyone who's listening to, do be active. If you're interested in playing a role, please contact Irene Butler at our advocacy office. We've got lots of work to do, and we can use as many members as possible to help us with that. And I've had a great time listening to this discussion. Every year it's a little bit different, and I'm sure it'll be a little bit different next year. So I want to again thank Dr. Rosenbaum, Lauren Aaronson, and Dean Rosen for helping me with this hour's discussion.
Thanks for having us. Enjoyed the conversation.